what kind of pulse will be showing the Swan acid? Is where? At least you can know the place. Right guan, right? Right guan can be very floating. You have to imagine there are 3 springs under each finger, just like a trumpet. You know the trumpet, right? 3 fingers under 3 springs. That's 3 springs are different. The strength, the power, the rebound are not the same. Some of them are strong, maybe one of them is very strong, and one of them is very weak. In this case, the strongest rebound will be under your middle finger, on the right guan. It's stronger and higher, I mean more superficial than the cun and chi. So how do we have ulcer? Ulcer not necessarily means bleeding or hemorrhage, but whatever. When we have ulcer, what kind of pulse will be for ulcer? There are 2 pulses. First is for duodenal ulcer. Second is for the stomach ulcers. Different. Sometimes they all combine together, kind of difficult to find out. Actually, the reason for the duodenal ulcer is too much acid. It's a result of the first stage. So what organ produced acid? What organ is responsible for giving too much acid? I'm sorry. Who is responsible? Huh? Huh? Yeah, stomach has ulcer, but who is responsible for giving him this ulcer? Liver. So what do we do about the liver? The same thing, just like instant haotang or something. So, well, I'm sorry, what I'm saying is, you know it's liver, so what would the pulse be? What's the pulse for liver? I didn't mention this morning, but I'll tell you now. Just wiry, so simple. What does it mean wiry? Just like a straight tube like this. The pulse. Pulse is a vessel. It should be like this, but sometimes it's not, right? You all know that in your hand, cun is a little bit higher than chi. It's not a straight line, but there could be a straight line under your right finger. I'm sorry, the right guan, then it's duodenal ulcer. If it's not, it's stomach ulcer.